Welcome back to Your Health this Wednesday, and we are discussing the issue of antimicrobial resistance. Well, this topic is important because we are discussing how parasites, bacteria and viruses, these microorganisms, change ways that make them ineffective to medications when it is administered to you. And just before the break, we are talking about the cost of this antimicrobial resistance, or the cost of not responding to medication as we may know it once being treated, and it may take longer than expected and may be more costly than expected. And so before the break, we're just looking at the cost in terms of the human aspect, human health care. And now we want just to hear from Dr. Azegela on the cost of this resistance when it comes to the farmers or the farming practice. Dr. Ari.
Yeah, thanks. I would just take the reflection of, say, a dairy enterprise, where one dairy animal, which could give you an average of 40 liters a day, suffers mastitis. And apparently the bacteria causing the infection could be resistant to the commonly used intramammaries or antibiotics used to treat it. So you find the udder gets infected. From the production of about 40 liters, the thing drops. And at the same time, whatever you are to milk from that animal during treatment has to be discarded. So the duration during treatment, if it's good enough and the bacteria are responsive and the animal recovers, you can consider a duration during treatment where 40 liters are discarded per day. That's quite a significant amount of money lost to the farmer. And then the other flip side, in event of that bacteria being resistant to the treatment it's being subjected, the animal is being subjected to, you find you either upscale the kind of drugs you use, which are more expensive, and they may be effective in that case. Now, still, during the same time, you lose out on the production. The worst case scenario is where the udder that you actually get the milk from, you find it severely infected and you may have to dry out. That is, the udder cannot produce anymore and it's totally damaged. Mm-hmm. And you find you may have to get on, in some cases where you want to keep the animal, you may need to finish treatment and retain 3/4 of the teats to milk from. That production will definitely not be the same. And considering the average cost of a good dairy animal, it's upwards of 100,000. So you imagine probably it has just, you've had it for a year, you have invested over 100,000 plus other investments, and then suddenly you have this issue. You end up hitting a loss that you sincerely may discourage you from continuing with that enterprise.
Okay. Yeah. And I guess the issue of resistance to medication has been also made, is it worse, or by the fact that the last time we had actually an antibiotic being manufactured was in the 80s. So it's been almost 30 years where there's no new molecule of antibiotics. And the WHO recently just listed about 10 countries where they had a treatment failure for a certain class of antibiotic, treatment failure for gonorrhea for a certain class of antibiotics. And this included Australia, Canada, France, Japan, the UK. So it's not just an issue that is local here. So the question then would be, if we are not having any new molecules of antibiotics being produced to be able to address these issues, what is happening then?
Okay. Of course, the question I would ask myself first is why? Why don't we have new antibiotics being developed for the last 20 years or so? And I believe one is that research and development for antibiotics is a huge investment that pharmaceutical companies undertake. And if they invest in developing antibiotics, and it's just a couple of years, and these antibiotics are resistant, then there is no motivation, there is no incentive to invest in research and development for antibiotics. Secondly, at the moment, it's more lucrative for pharmaceutical firms to invest in developing medications used for chronic conditions, because then there's a better return on investment. If I have diabetes, for instance, I'll be on medication for 20, 30, 40 years. So my take or my proposal would be for governments to get involved and incentivize pharmaceutical companies, offer them subsidies to be able to invest, to invest in research and development for new antibiotics. Otherwise, pharmaceutical firms will not. Yeah.
Dr. Nyakiba, are we looking at a point where we are going back to the pre-penicillin era? That was the era before penicillin was discovered, and it actually changed the management of infections. At this rate, if we are getting resistance to gonorrhea or urinary tract infections, simple infections that would respond to antibiotics, are we regressing back to those eras before penicillin?
Yes, that seems to be the case, unfortunately. Remember antibiotics, the first group of antibiotics being marketed, we are talking of 1940s. We are talking of discovery in 1928, but properly being used in clinical setups, you're talking of the 1940s in the world wars and etc. So from 1940, we had a period of rapid development of antibiotics. Quite a number of these antibiotics are quite old. Then, and that massively improved public health. We now had people surviving infections that previously they were dying from. And then we had a period also after that of massive use of antibiotics, massive access, easy access of antibiotics. And I think for Kenya, for example, we are at that point of the cycle. And then now we have antimicrobial resistance taking us back to before 1928 and 1940, which means, if you remember the Spanish flu, all this, the plagues, they used to wipe out 2-3 million people in quite a short period of time. So we are now looking, and it has been projected, as I was initially saying, that if we proceed on the same path, then as we approach particularly towards 2050, we will officially be in a post antibiotic era that pretty much looks like the pre-antibiotic era, or probably nastier. Remember, antimicrobial resistant pathogens or bacteria cause more severe illness than what is not resistant. So it probably even worse. And then remember also what Collins is saying, that so you have this increasing use and antimicrobial resistance, but you also have a period, as you're saying, that we do not have new products coming into
being developed.
Exactly. So you have a double-edged scenario. So I think the message is we need to, as they say, count your blessings one by one. I think we need to count our antibiotics one by one and use them well.
Okay. Now I want us to just wrap up, and I know globally November they have a week for Antimicrobial Awareness Week, and this came from actually the United Nations General Assembly in 2016, where they put the issue of antimicrobial resistance on the forefront. And the WHO theme for this is antibiotics handled with care. And this cannot be done by one line of health care, that is just only the human health, but also the animal health point of view, and that's why we're developing the National Action Plan. So I would want to just take your comments on what people should do from an individual point of view so as to not contribute or to be aware of antimicrobial resistance. And I'll start with Dr. Azegele.
Yeah, just to correct you a bit, the theme this year is you seek advice from a qualified health professional before using antibiotics. And when you talk of health professional, people assume it's only human health professionals. You're seeking health professionals covers the two, in fact 3. There's the human health professional, the animal health professional, and even plant health professional, because there's those antibiotics used in plants. And okay, for this year, with regard to the World Antibiotic Awareness Week, this is a very, very unique year for us, and it's very, very, we are a bit excited about it, because this is the year when we have developed our policy on prevention and control and containment of actually antimicrobial resistance, and we have the 5-year National Action Plan, which we will be launched on the 13th at Kenyatta National Hospital grounds. And there are several events which are lined up this year to mark the week. There's also a symposium at the College of Agriculture and Veterinary Sciences. There's a one-day symposium which will be held. And then also there'll be various talks with students in various faculties, so that the awareness on use of antibiotics is there. Hospital visits will be done. So these events, the coming week will be a week when we want to create the most awareness and have people appreciate that antibiotics are to be used on advice.
Okay.
Yes.
Dr. Nyakiba, just briefly, your closing comments?
So I think, yes, to reiterate again on the theme, so from an individual patient or public perspective, individuals need to, number one, seek professional advice. Do not use antibiotics except as prescribed and in the manner that is prescribed. So we need to, and also buy your antibiotics or get your drugs from registered, licensed outlets, and use the antibiotics as you have discussed with your doctor. Do not share antibiotics. Do not buy antibiotics over the counter. Do not use it for anything else other than what has been prescribed and advised.
Okay. Dr. Jaguga, just briefly.
Yes. In addition to what my colleague Jared has said, in terms of buying medications from registered outlets, I'd want to go ahead and say that the Pharmaceutical Society of Kenya has an accreditation program. And you will know that a pharmacy is accredited if it has the Green Cross. So that tells the public that this pharmacy has met the basic minimum standards in terms of professional practice. So yes, buy medicines from a registered outlet that has a Green Cross on it. Thank you very much.
Okay. Thank you very much, gentlemen, for your time this morning. Thank you for sharing your thoughts and your information on antimicrobial resistance, which, again, I'll say again, it's when microorganisms change the ways in which they are making the use of antibiotics or some of these medications ineffective. And at the end of it, it becomes costly to treat infections. It takes longer to treat infections. And some of these life-saving procedures like organ transplant, chemotherapy, major surgeries put people at risk, because now the medication that is used on them, they do not respond, or the microorganisms that they have will not respond to some of these medications. And that was Your Health this morning with me, Dr. Mercy Korir.
Thank you very much, Dr. Mercy Korir, and the fine gentlemen doctors who are here. And mine is basically, first of all, to thank you for getting that information out, because I think it's very important. But secondly, it's more of a concern and maybe your advice, especially on self-medication. You'll find, especially when it comes to parents, you'll find a child possibly gets a cold, and there is almost a predictable path. With time, they have a sore throat, then after that, they have a temperature. So when you go to the doctor, they give you an antibiotic. Over time, you want to cut out the consultation fee and just, give the child the medicine that you're used to, or you have a cabinet in the house where you have all these medicines and this one lowers temperature. Is there a risk to that? Any of you maybe can answer that.
Yes, there is definitely a risk to that. That is still inappropriate use. A child, remember, even viral infections will present with a fever. So a child having a fever does not mean they need an antibiotic. So again, seek professional advice, and that's actually a big thing. We all have small pharmacies which are quite well stocked. I think we need to cut on that.
Okay, and that's not just so that they can come and pay consultation fee. It is actually a concern.
Yes, it is.
It's very similar to farmers who have a full stock of drugs set aside for purposes of administering to animals. And they do actually diagnose, treat, and yet it's not, they may not be actually treating for the disease that they perceive
the
it to be.
To have.
Yeah.
All right, thank you very much. I think we'll have to wind it up right there. Thank you, Dr. Mercy Korir, for hosting that. And well, this is where we say goodbye on Morning Express, and thank you for watching. But do stay with us right here on KTN News. We have News Center starting in just a bit, and Betty Kialo will be hosting you on that. So do have yourselves a wonderful day and stay healthy.